So good evening everyone. Is the audio and the video clear? Is the audio and the video clear? Great. So we are going to talk about a small topic today, a few questions based on major and minor connectors in RPD. So this question has been asked to me a lot of times as a doubt. So what would be the answer to this? The major drawback of non-rigid major connector. Okay, most of you have replied A. So that is right. But what we need to understand here is that, a question like this will be asked in different ways. In the same quiz today, I am going to put up this same question in a different way with a different set of options, wherein you can understand how a non-rigid connector question is usually asked in the exam, right? So when we come to the second question, I'll explain it to you as to what is the actual difference. What is the answer to this question? Posterior palatal bar is placed on. Right. So, the answer to this question, the junction of hard and soft palate, is the correct answer which you have seen in your textbooks, but most of the times clinically it is placed on the hard palate. If you remember, the posterior palatal bar is always placed posterior to the second premolar, right? To the second premolar. So, uh, you know, when you are placing a posterior palatal bar in a situation wherein the maxilla is like this, right, and you have teeth which are present here, a few missing teeth. Now it is very difficult to put across the posterior palatal bar at this junction, right? Because there would be no teeth in this area to hold the bar. So, according to pulse, the answer which is given is 3, which all of you have marked. But the answer ideally for this question remains placed on the hard palate entirely. Right? Ideally, this is the answer, and I have explained to you that when you talk about a posterior palatal bar, let me I'll just show you a picture of the posterior palatal bar, right? So this is how what you see here is the posterior palatal bar, right? So if this is the posterior palatal bar, imagine having the posterior palatal bar onto the hard tissue and the hard palate soft palate junction that is too far posteriorly, right? So it is majorly on hard palate, right? That is why I have put this question in the quiz, because I know that there is a confusion as far as the answers are concerned. What would be the answer to this question? what is the cross section of the minor connector? Absolutely right. So the cross section of this minor connector is triangular. If you see this diagram here, you can very well identify this triangle which you are able to see here, right? This is the minor connector, right, which looks triangular. And when you see in the explanation for this, it is thickest towards the lingual side, thickest towards the lingual, and as it moves towards the buccal side or the buccal surface, it is becoming a little thin, right? So a triangular cross section always, and thickest near the lingual line angle and thinnest near the buccal line angle, right? What should be the answer to this question? Internal finish line. Great. So, if I ask you about the external finish line, what should be the angle between the external finish line? What would be the answer for external finish line? Great. So external is always an acute angle which is less than 90, and internal is a 90-degree butt joint. Now, what would be the answer to this question? Which type of minor connector does not have an internal finish line? So, all of us know what is an internal finish line. An internal finish line is the one which is at the level of tissue, right? The junction between the minor connector and the acrylic onto the tissue side is the internal finish line. Yes, absolutely. The answer is nail head. Sometimes they given the question as beads. So beads and nail heads both are the correct answers for this. Palatal bar is contraindicated in. Great. So palatal bar is basically indicated only for Kennedy class 3, which means for tooth supported restoration, tooth supported RPD. Which is the last choice of connectors for mandibular major connector? Last choice, which means if we are not able to do any other major connector, I would select this major connector, which is that. So I can see a couple of twos and majorly fours. right? So 4 is the correct answer. Labial bar, double lingual bar, split lingual bar, they are all still used in the, in cases of mandibular RPDs, but labial bar is not used. And why is it the last choice? Because if you put a labial bar, that is going to distort the lower lip, right? It is going to distort the lower lip. That is why it is the last choice of connector. Right? So the answer here is, everybody okay, clear? Have they understood? Have all of you understood that why labial bar is the last choice? Because the labial bar is going to distort the lower lip. It is going to cause food entrapment as well, and the aesthetics will be damaged. Which of the following is primary function of a minor connector? Yes, I am coming back to that question, sweetie. We are going to come back to that question. Great. So, if I frame this question in a slightly different manner and I ask you which of the following are the functions of a minor connector. So, if the question is not focusing on the main function or the primary function, the answer is going to be all of the above. But if the question has clearly asked you primary, then all can never be the answer for any question. So look into the question if they have asked about main, or they have asked about primary, right? Or if they have asked about first and foremost. So if they have asked you something like this, they are looking at a specific answer and they are not looking at all of the above, even if all the other options are true. So in this question, all the other options are true, right? They are the functions of minor connector, but they are not the primary function. Main disadvantage of anteroposterior palatal strap. So you are confused between 1 and 4. Okay. So the answer here is distress in speech, not the weight of prosthesis. The weight of prosthesis is a problem in complete palate. It is also, the when you have the entire palate covered up with metal, there is where the weight of the prosthesis increases, right? For anteroposterior palatal strap, it is the distress in speech which is the main disadvantage. The second disadvantage would be tissue reactions, right? Because tissue reaction is a disadvantage of any major connector which contacts a lot of palatal tissue, right? If it is contacting a lot of palatal tissue, it might cause tissue reactions, right? Quickly, very simple question. This one is a very simple question. which of the following is true for Kennedy bar or double lingual bar? This Kennedy bar or a double lingual bar is also called as continuous bar. It is also called as continuous bar, right? That is the another term for a double lingual bar. Great. So is it pear shaped or is it half pear shaped? What is the shape of a lingual bar? What is the shape of a lingual bar? Not the double lingual bar, a lingual bar. Is it half pear or is it pear shaped? Half pear, right? So you're sure that half pear is the lower bar, and there is only one option where I have mentioned lower bar as half pear shaped. So do not get confused by these kind of questions. These are very straightforward. There is no need even to read all the options, right? So there is only one option where they have mentioned that the lower bar is half pear shaped, which means that this can only be the answer. Even if you don't know the shape of upper bar, that's absolutely fine. You don't need to know the upper bar shape to answer these kind of questions. That is why I have put up this question, so that you do not get confused when you see such questions in the exam. The first option is very close to the answer but is not the answer, right? If you had an option here where half pear was not at all written in any of the options, then your answer would have been pear shaped, right? So the answer to this question is third option, right? The third choice. So ledging effect and step back technique, they are features of which kind of major connector? Great. So they are all for linguoplate or lingual plate. What is meant by ledging effect and step back technique? So I'll just take you to that page of ledging effect and step back. So what you see here in this diagram is the ledging effect, right? This is the ledging effect. So when I say ledging effect, it means that the ledge which is formed here, where the major connector is contacting the tooth, should be so smooth that the patient cannot feel the transition when the patient is moving tongue. They cannot even feel the transition from when they have touched the major connector and when they have reached the cingulum of the tooth. That is the ledging effect. And when we talk about step back, this what you see here is a step back. There is an open embrasure here, right? This is an open embrasure, and in this open embrasure, so that there is no unesthetic display of metal, we just go a step back and then again put up the metal, again go a step back and then the metal, a step back and then the metal, so that the edentulous part or the diastema part can be kept as it is, and there is no problem for the patient as far as aesthetics are concerned, right? So is it clear now? The ledging effect and step back both happen in the lingual plate. The same question from where we started, right? The first question, which was related to a non-rigid major connector, another question related to a non-rigid major connector. What would be the answer for this? Now, there, the question was asking about near the abutment, far from the abutment, is what was the question. Where does it give load? So, when you see this kind of question, it is causing periodontal destruction of the abutment teeth, right? So you have to see if this question is talking about which area of saddle, near or far, you answer accordingly. Otherwise, if the question is asking about abutment teeth, then you answer accordingly, right? It is the same question with different sets of answers for it, right? What is meant by snowshoe effect? What is meant by snowshoe effect? It deals basically with which part of RPD, snowshoe effect. What is meant by it? Very good, absolutely right. And so, snowshoe effect is basically about more coverage, right? When you cover more part of the tissue, when you cover more part of the hat palate, that is called as a snowshoe effect. So basically, snowshoe effect means broad distribution of forces on the basal tissue areas, right? On the basal seat area or the tissue. Just a couple of image based questions, one or two, and then you are free to rest. What do you see in this image? Oh, no, sweetie, this is not swing lock. Swing lock is a little different from this. Yes, Star Lord, we will do a session on clasps. Next time we are going to talk about direct and indirect retainers. Right, absolutely right. So, this figure which you see here is labial bar. What is this figure? No, Jagrati, it's not antero-posterior strap. See, when you talk about an antero-posterior strap, it will always have two straps, one in the anterior, one in the posterior, and there will be some space in between, right? So, what you see here is a posterior palatal strap. In anterior, you will have an anterior strap as well, right? That is why this is not antero-posterior palatal strap, this is posterior palatal strap, right? So next time when we meet for quiz, it is going to be approximately a 45-minute session because I am going to talk about two important topics that day, which are direct retainer and indirect retainer. Right? We are going to talk about these two topics. Keep your doubts ready so that we can solve it then and there, right? That is all from my end. Have a good night, sleep tight, and keep working hard, right? See you again soon.